But first, a big concern among Washington's youth. In the last 2 weeks, the highest COVID rates are in young adults between 20 and 24. And doctors say that group is spreading it to people more at risk. Hello again, I'm Simni Kim.
And I'm Dave Wagner. Thank you for being with us today. There are more than 55,000 cases here in Washington, more than 1,500 deaths. And of the more than 973,000 tests, 5.7% have come back positive. KIRO 7's Allison Grande joins us live tonight. And Allison, doctors expect hospitalizations and deaths, unfortunately, to rise.
They do, Dave, linked to those young adults ages 20 to 24. They want them to realize the impact of their socializing. Now, in the last month, 147 students at UW's Greek Row have gotten COVID-19, and health officials believe it's spreading from there. We saw students lined up to get tested at UW after the COVID-19 outbreak hit Greek Row earlier this month.
And I'm honestly surprised that more people didn't get infected.
So far, the University of Washington says 147 students contracted coronavirus living on Greek Row or socializing with students who do. Across all 3 UW campuses, another 63 students tested positive. In the last 2 weeks, statewide, the highest rates of COVID-19 occurred in young adults between 20 and 24.
Even if they are not as worried about getting particularly sick, it's incredibly important that they continue to wear masks, observe social distancing, and wash their hands. We need to protect the people who are most at risk.
We started seeing increased activity in young people. Since then, we've seen an increase in persons being infected in other age groups.
Right now, UW Medicine has 38 COVID patients across their 4 hospitals. During the peak back in March, it was around 120. But state health officials expect hospitalizations and deaths to follow the spike in cases among young adults.
The number of hospital admissions for COVID-19 is increasing in almost all of the age groups.
We've been hearing about sort of the social gatherings that people are having. Again, I think where people are sort of letting their guard down.
But it appears to state officials, protests are not a place where people are getting sick.
Luckily, so far, out of thousands of people tested, the pool of folks who have received that testing have had extremely low positivity rates in the Seattle area. And whether that is due to really good masking or strong social distancing or other, we don't know precisely.
UW says there's no connection between those positive cases and any instruction or work on campus. Now, in the fall, UW plans to only have 10% of in-person classes. They say they'll release a more definitive plan early next week. Allison Grande, KIRO 7 News.